Jolessa is a combination hormone medication that contains two hormones, a progestin, levonorgestrel, and an estrogen, ethinyl estradiol. It is used to prevent pregnancy and may also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases such as HIV, gonorrhea, or chlamydia. The recommended daily dosage is to take one pill at the same time every day. It's best to take Jolessa at the optimal time, so it's important to follow the instructions provided by your healthcare provider. Before starting Jolessa, make sure to carefully read the patient information leaflet provided by your pharmacist. It contains important information on when to take your pills and what to do if you miss a dose. Take Jolessa by mouth once daily at the same time each day. It's important to take it exactly as prescribed and not to skip any doses. If you experience vomiting or diarrhea, you may need to use a backup birth control method. You can take Jolessa after your evening meal or at bedtime to help prevent stomach upset or nausea. Start taking the medication on the first Sunday following the beginning of your menstrual period. If this is your first time using Jolessa, use an additional form of non-hormonal birth control for the first 7 days. Consult your doctor or pharmacist if you have any questions or need to switch from other forms of hormonal birth control. You may experience nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change while taking Jolessa. Vaginal bleeding between periods, especially during the first few months of use, is also common. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. During the 3 months of taking the active pills, you should not have your period. Instead, you will have your period once every 3 months during the week that you are taking the inactive pills. If you do not have your period while taking the inactive pills, contact your doctor for a pregnancy test. This medication may raise your blood pressure, so it's important to monitor it regularly and inform your doctor if the results are high. Serious side effects may include lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, yellowing eyes/skin, or serious problems from blood clots. If you experience any of these, seek medical help immediately. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, it's important to seek medical help right away. Remember that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. If you are over 35 years old and smoke cigarettes, do not use Jolessa. Smoking while taking this medication can increase your risk of stroke, heart attack, blood clots, and high blood pressure. The risk of these serious problems increases with age and the amount of cigarettes you smoke. It is important to avoid smoking or using tobacco while taking Jolessa. Before taking Jolessa, it's important to let your doctor know if you have any allergies to ethinyl estradiol or levonorgestrel, or to other estrogens or progestins, as this medication may contain inactive ingredients that can cause allergic reactions. You should also discuss your medical history, especially if you have a history of blood clots, high blood pressure, cancer, diabetes, heart problems, liver or kidney disease, or have had surgery recently. If you have diabetes, Jolessa may affect your blood sugar levels, so make sure to monitor your blood sugar regularly and inform your doctor of any changes. It's also important to inform your doctor if you are planning to have surgery or will be confined to a bed for a long time, as these conditions can increase your risk of blood clots. This medication may also cause changes in your skin, so it's important to limit your time in the sun and avoid tanning booths. If you wear contact lenses, you may experience vision problems, so be sure to contact your eye doctor if you encounter any issues. If you are considering becoming pregnant, it's important to consult your doctor, as it may take longer for you to become pregnant after stopping Jolessa. Additionally, this medication should not be used during pregnancy, and if you become pregnant while taking Jolessa, you should inform your doctor immediately. Lastly, Jolessa may decrease breast milk production, so it's important to consult your doctor before breastfeeding while taking this medication. It is important to be aware of potential drug interactions with Jolessa, as they may change how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Jolessa include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Additionally, some drugs may cause hormonal birth control to work less effectively, such as griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. It is important to tell your doctor when starting any new drug and discuss if you should use additional reliable birth control. If you experience any new spotting or breakthrough bleeding, it may be a sign that your birth control is not working well. Furthermore, Jolessa may interfere with certain lab tests, potentially causing false results. Make sure that lab personnel and all your doctors are aware that you are taking this medication. Remember to always consult your doctor before starting, stopping, or changing the dosage of any medicines. If you or someone else has taken too much Jolessa and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can contact a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. Remember, Jolessa should only be used by the person for whom it was prescribed. It's important to have regular physical exams and medical tests while taking Jolessa, including blood pressure checks, breast exams, pelvic exams, and pap smears. Make sure to follow your doctor's instructions for examining your breasts and report any lumps right away. It's important to keep all medical and lab appointments. If you have any questions, consult your doctor for more details. If you miss a dose of Jolessa, refer to the product package information for advice on what to do. It's important to use backup birth control, such as condoms or spermicide, to prevent pregnancy if you miss a dose. If you have any questions, make sure to ask your doctor or pharmacist for guidance. If you frequently forget to take your pills as directed, it's a good idea to talk to your doctor about switching to another form of birth control. This can help ensure that you are protected against pregnancy. When taking Jolessa, it is important to store it at room temperature, away from light and moisture. Be sure to keep it in a safe place where children and pets cannot reach it. Do not flush Jolessa down the toilet or pour it into a drain unless directed to do so. Make sure to properly dispose of this medication when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance on the proper way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.